Thank you, Mr. Chairman. Secretary Kennedy, do you know the requirements for hospitals under the Emergency Medical Treatment and Labor Act, which is commonly called by its shortened name, EMTALA?
Yes, I do.
And just generally, what do you know EMTALA to require of hospitals?
That every hospital has to treat anybody who comes to the emergency room.
And they have to provide stabilizing care regardless of their ability to pay and regardless of the type of care required, correct?
Exactly.
And Secretary Kennedy, you understand that according to the American College of Emergency Physicians, the American College of Obstetricians and Gynecologists, the American Medical Association, and the Society for Maternal Fetal Medicine, in certain circumstances, necessary stabilizing care for the purposes of fulfilling a hospital's obligation under EMTALA could be providing abortion care, correct?
In cases, for example, ectopic pregnancies and botched abortions and in miscarriages, those hospitals are required to provide care. Elective abortions, they're not.
But they are required to provide abortion care if that is the care that a physician treating the patient determines in their medical judgment is the care necessary to stabilize the patient and to protect their life and health, correct?
And because there were confusion about that, I sent out a letter to every hospital in America restating that in those conditions they must provide care.
Okay, and I think that that's consistent with what we have heard from emergency physicians, obstetricians, other treating physicians that have made clear that in certain circumstances, clinically recognized, evidence-based, necessary medical treatment in various circumstances, including but not limited to the ones you just listed, abortion care is the necessary stabilizing care or some kind of care that may end a pregnancy. So in those cases, you would agree with me that EMTALA requires the hospitals to provide that care?
Yes.
And
that's what President Trump believes.
And you just mentioned that you issued some guidance to all the hospitals and care providers across the country, rescinding some guidance from the prior administration and making clear that that is the requirement. Now, the guidance that you rescinded was issued shortly after the Dobbs decision, which was announced 3 years ago today, and created some confusion. And so I think one thing that's important, one thing that I hear from doctors in states like mine, is that this kind of guidance and clarity is very, very important to giving the practicing physicians the comfort that they need to do their jobs. And so I think it's really important that you continue, and I hope that you'll continue to make as clear as you have today in this hearing, that EMTALA ensures and protects pregnant women in all 50 states.
I will continue to do that, Congresswoman.
And with the time I have left, on one other note, in response to some questions from Mr. Pallone earlier, he talked about, as I believe Ranking Member DeGette has as well, several of the letters that our committee has sent, or members of our committee have sent to you with concerns about actions being taken at HHS. And certainly, I agree with a lot of those concerns. I represent Houston, Texas, and we have an incredible amount of research going on through National Institutes of Health, incredible development of all kinds of transformative therapies and treatments. And so we have a lot of concerns. I know you mentioned that you have gotten thousands of letters from members of Congress, and I can appreciate that. But I would ask that, recognizing that this committee, the House Energy and Commerce Committee, has jurisdiction and is the committee of jurisdiction over HHS, that the requests that come from the ranking member, that come from the Energy and Commerce Committee get prioritized by your staff in terms of looking at congressional responses. I think it would be very important because we have jurisdiction, and you've indicated you'll work with a lot of folks here on a lot of different issues, and getting those answers and being able to work to address the concerns that we have is really important. So I just ask that you prioritize those responses.
You have my commitment to do that, Congresswoman. And I would also say this, and it's the same thing that I said to Congresswoman Dingell. it's not our intention to cut anything that is the kind of research that you're talking about, which is critical research. We need to keep America the hub of that kind of research. And there was some malicious compliance. There was some mistakes made.
Thank you, Mr.
gentlelady's
Secretary. My
time is-
time has expired, and so I will
gentlelady's
go
time is
back.
Examples, contact us, and we will redress them.